So today I am introducing you to the awesome Jessica Turton, who is an accredited. Oh, okay, let me cut.
I'm so glad you did that.
Have those problems.
It is a tongue twister.
It is. Let's start again.
Okay.
Today, I am really excited to introduce you to Jessica Turton, who is an accredited practicing dietitian and is a summit presenter. Thanks, Jess, for coming and chatting today.
Thank you. It's good to be here, and it's nice to be a part of the Women's Low Carb Summit. Thank you for organising that, Tracy.
Awesome. Awesome. Do you want to start with telling everyone a little bit about you, Jess?
Yeah, so as you said, I am an accredited practicing dietitian. So I've been practicing for about 3 years now, and I have my own online business. So I consult one-on-one with people all over Australia. And then I also consult from clinics as well around Sydney. And I work with doctors who a lot of you probably know, working together with doctors to sort of provide medical nutrition therapy. So I'm very much in the clinical setting, but of course, you know, people can reach out to me for any reason, really. I will never turn someone away. But I really, really love consulting with people one-on-one, but that's just 50% of my life at the moment, because the other half is my research as well. So I'm doing my PhD at the University of Sydney, and I'm doing research in low-carbohydrate diets and diabetes management. So in particular, it's focused on type 1 diabetes, but I'm also using the literature from type 2 diabetes to kind of help us with the protocols for type 1. So yeah, it's very exciting.
Awesome. Well, we have actually chatted a couple of times on my podcast, so I'm going to put down below those chats if anyone's really interested in really learning more about your research and what you've uncovered, because you know, just fantastic stuff, and so many more people need to do what you're doing, but so grateful that you're doing what you're doing. But in terms of why you personally are passionate about low carb, how has that come to be?
Yeah. So I suppose you could say I have been an expert dieter as pretty much all my life, and so have my parents, really. So that's probably where it came from. Like, a lot of my family just like in the dieting world for one reason or another. But when I was quite young, so when I was going through high school, I was really just stuck in the toxic dieting cycle and went through long stages of just restrictive eating and massive weight loss. And that would be followed by excess and binging and overeating and weight gain. And it was like this roller coaster. And I just had this terrible toxic relationship with food and a terrible relationship with my health, to be honest. It was just all about weight and the number on the scale. And it was when I started university, there was a particular lecturer who was talking to us about the role of insulin in fuel utilization. And I had done so much research on diet prior to this. It wasn't even funny. As I said, I was an expert dieter. I'd done all the diets, but I'd never come across the role of insulin before and the sort of hormonal model of obesity. So I totally understand how there's heaps of people out there that haven't come across it too, because it's not necessarily easy to find unless you know what you're looking for. And so after learning about just like the fundamentals of physiology and biochemistry, I realized that it was carbohydrates that's caused insulin to rise the most, and insulin was our fat storage hormone. And I was still in the toxic dieting cycle at this point, and I still just wanted to lose weight. So I started a low carb diet, and I did it in the same way I do all my other diets, but this time it was a very, very different outcome. And I was able to really not only find my healthy weight, but build a really strong relationship with food. And then since becoming a dietitian and a researcher, just delving into all the research that exists on low carb diets and seeing what it can do for people, it's just really, really ignited my passion for it. And it's hard to actually now that I know what I know and all the information that's out there, it's hard not to find a reason to recommend this type of approach to people, because it just is so applicable in so many different ways. And yeah, even though my diet now looks different to what it did 5 years ago, I've always followed this low carbohydrate template, and I've never stuck to anything for so long. So really it's a lifestyle without even trying, if that makes sense.
Absolutely, absolutely. So that brings us nicely into what you are actually presenting at the summit, because I mean there would be so much you could talk about, obviously, but what is a little snippet of your presentation?
Yeah, so my presentation is about addressing your physiology with nutrition. So what that actually means is, a big thing I promote, as I was kind of alluding to before, is the idea of achieving food freedom. And it's something you and I have spoken about a lot. And it basically means having a healthy relationship with food, but also being able to achieve your health goals. So we know that there's people out there that promote building a healthy relationship with food, but it often comes at the expense of not being able to achieve your goals. So like, don't worry about reaching your healthy weight or losing weight. Just love yourself, love your body. It's like an order, as opposed to teaching you how to actually do something and how to feel better within yourself and build that relationship with food. So what I learned for myself, and also what I've learned for my patients, is that in order to achieve that sense of food freedom, we really need to address our physiology first. And what that means is looking at micronutrient status, and even looking to see if we're having enough of our macronutrients, which are essential nutrients in the diet. If we're not getting enough of those, then that can sometimes exacerbate the signs and symptoms that we associate with not having a healthy relationship with food, like anxiety, depression, digestive issues, low energy, the urgency to binge, those types of things. So it's kind of, for me, addressing your physiology first and then looking at the mindset second.
Fantastic. It is so common that often, people do look at either one or the other. And I love that you are bringing both of that together, because I mean, I'm all for, loving yourself and a positive body image. And I think sometimes we get a bit of a bad rap out there because it looks like we're not appreciative of that, but we absolutely are. But when you understand what you were just saying about physiology, when your body isn't getting what it needs, it's going to be very hard, to ignore it and, to get those things that you do want. So I think that is fantastic. And I can't wait to hear about, hear your talk and bring that in and just share that information with so many women out there who just, I guess, with just a little bit of tweaking, with a little bit of knowledge on how our body works, when we can fuel it in a way that it's designed to be fueled, so much of that will just change without us having to do much about it.
Yeah, it's like weight loss is the side effect, really, at the end of the day. And that's what it was like for me. I went into a low carb approach just wanting to lose weight, but I sort of found so many other benefits just in terms of feeling more comfortable in my body, feeling stronger, more energetic. And what I realized is all of those feelings of well-being, I suppose, actually make you feel better in your own skin, irrespective of your weight. So even though you do end up reaching a healthier weight with this approach, it's not your sole focus anymore. It just kind of becomes a side effect, which I think is a really nice part of it.
Yeah, absolutely. So last question I have is low carb sustainable? So it's interesting because I do find most of us do come to this lifestyle, yes, as you said, for weight loss or for some, health, really sort of chronic health condition or something like that. But it is, so much more than just that. And I think the misunderstanding out there of it being a label and it being just another diet means many people don't understand the sustainability of it. So what's your view on whether it is sustainable or not?
I guess it partly comes down to how you build your low carb diet as well. I mean, as I said before, it's something that I found really, really easy to sustain. But I've tweaked my own diet over time. And I suppose, I mean, I'm a dietitian, so that's what I do for a job. I help people tweak their diets to make it work. So I suppose I'm in a little bit of a different position to a lot of people. But with my clients, it's definitely sustainable. I've seen so many people keep up a low carb diet, and we have so much research to show that it is sustainable. But it definitely depends on how you build the low carb diet. Because I've seen people who have come in and they say, I did the keto diet, I lost all this weight, and then, you know, Christmas came and I fell off the wagon, I gained it all back, and now I can't get back on, and that type of thing. Like, this getting off and on thing, as if it is just another restrictive diet. And I see a lot of people bring in their sort of old habits into a low carb diet, which makes it less sustainable. So trying to couple carbohydrate restriction with fat restriction or calorie restriction, and then just trying to layer too many things, like also do fasting and all these other things that people think they have to do, which does make it less sustainable. And I think a lot of the studies out there on low carb are built in such a way where it's calorie restriction and carbohydrate restriction. And a lot of those particular studies, the participants don't stay on the diet and they end up regaining the weight, or their blood sugars return back to normal. And this is if the study goes for like a year or 2 years. But if you look at the studies that allow ad libitum low carbohydrate eating, which is eat as much as you want of the recommended foods, it's more likely that the people are going to sustain the diet. So that would be more so what I would recommend. But also people just need to keep tweaking and find what works for them, I suppose. And then, yes, it's definitely.
Yeah, that tweaking thing's really important. I think, you know, for me personally, it was really 18 months to 2 years to really find my groove. And I mean, I'm 6 years into it now, and I'm probably still tweaking because as I'm getting older. But just doing that, listening to your body, tweaking it, playing around with it is really important. One thing that came to mind there, I know we've even talked on one of our chats before around this, you know, what you've looked into in terms of the research out there on low carb diets. But it's interesting too, because I see a lot of people come into it and they just substitute, I suppose, their regular junk with low carb junk, you know, because over the last 5-6 years, there's a huge market now for, you know, these substitutes. And they're the people that I see a lot sort of going, oh, well, you know, it hasn't worked. I haven't lost any weight. But that's really because they haven't addressed the whole food side of things. It's more just trying to find the substitutes for their favorite foods. And I think that can trip people up too in terms of sustainability.
Yeah. So maybe you use those things when you're starting a low carb diet, and then you kind of gradually don't use them as a crutch anymore. Not to say you can't have those things. We all deserve to have treats, and we can all find a way to fit treats into our approach for sure. But the frequency of when they're coming in and how much is coming in is definitely going to impact your ability to reach your goals. And then if you're not reaching your goals, you're less likely to stick with the approach. But I think that as well, I mean, we don't necessarily have, as you were alluding to, we don't necessarily have the studies looking at those types of foods, so the highly processed low carb foods. So we really don't know what the impact is. So it's probably best we not, as I said, not avoid them per se, but not include them in our sort of, I can have as much as I want of those foods kind of list. It wouldn't be your ad libitum list. That would be your sort of treat kind of every now and then list. And it's good to sort of distinguish between those foods. Like, which foods do I want to have every day? Do I want to include in my diet that are going to give me lots of nutrients? And then which foods are more my sort of sometimes foods, as opposed to labeling them good or bad. But yeah, I mean, some people can't do a low carb diet without those foods. And so they are a really, really good way to help people transition into it. But yeah, if you're not reaching your goals with what you're doing, it's about changing your approach. much.
Absolutely, absolutely. And, you know, no judgment from any of us involved in this summit either. You know, I think we're all doing the best we can. And, you know, it's just a matter of trying to see different things and play around with things. And, you know, I think your approach is fantastic. You're just, it's just amazing to have a dietitian, you know, speak the way you do and to share your personal journey as well. And I'm so, you know, grateful to you for being a part of the summit. I think your talk's going to be amazing. So thanks so much, Jess.
Thank you, Tracy. I'm really looking forward to it. And I'm excited to see all the other talks as well. It all looks really, really exciting.
Yeah, it is. Thanks so much.
No problem. Bye.